Understanding pneumothorax, causes, symptoms, and treatment. Welcome back to our YouTube channel. Today, we are going to delve into an important topic in the world of medicine: pneumothorax. It's essential to understand this condition, its causes, symptoms, types, and treatment options. Definition of pneumothorax. Pneumothorax, also known as a collapsed lung, occurs when air leaks into the space between the lung and the chest wall. This buildup of air can put pressure on the lung, causing it to partially or completely collapse. Exploring different types of pneumothorax. Spontaneous pneumothorax. Spontaneous pneumothorax occurs without any external trauma or injury. There are two main types within this category. Primary spontaneous pneumothorax. This type often affects young, otherwise healthy individuals. It happens due to the rupture of small air sacs, blebs, on the lung's surface, leading to air leakage into the pleural space. Secondary spontaneous pneumothorax. It occurs in individuals with pre-existing lung conditions, such as COPD or cystic fibrosis. These conditions weaken lung tissue, making it more susceptible to air leaks. 2. Traumatic pneumothorax. Traumatic pneumothorax is a result of physical injury or trauma to the chest. There are two main subtypes. Open pneumothorax. This occurs when there's an open wound in the chest wall, creating a direct pathway for air to enter the pleural space. It's often seen in situations like gunshot wounds or stab injuries. Closed pneumothorax. In this type, there's no external wound. The air enters the pleural space through an internal injury, like a broken rib piercing the lung. 3. Tension pneumothorax. Tension pneumothorax is a medical emergency where air continues to accumulate in the pleural space, creating pressure that can compress the affected lung and even shift the heart. This can lead to severe complications, including cardiac arrest. 4. Iatrogenic pneumothorax. Iatrogenic pneumothorax occurs as a complication of medical procedures. These can include lung biopsies, central line insertions, or mechanical ventilation. While unintentional, these procedures can inadvertently lead to the introduction of air into the pleural space. 5. Catamenial pneumothorax. Catamenial pneumothorax is a rare type that occurs in women. It's linked to the menstrual cycle and involves the presence of endometrial tissue in the pleural space. This tissue can lead to inflammation, scarring, and air leaks. Causes and risk factors. There are various causes and risk factors that can contribute to the development of pneumothorax. These include trauma. Injuries to the chest, such as fractures or punctures, can lead to pneumothorax. Lung diseases. Conditions like chronic obstructive pulmonary disease, COPD, or cystic fibrosis can weaken lung tissue. Medical procedures. Certain medical procedures, such as lung biopsies or mechanical ventilation, carry a risk of pneumothorax. Smoking. Long-term smoking can damage lung tissue and increase the risk. Genetics. Some individuals may have a genetic predisposition to pneumothorax. Signs and symptoms. Detecting pneumothorax early is crucial. Here are some common signs and symptoms to look out for. Sudden chest pain. Sharp, intense pain, often on one side of the chest. Shortness of breath. Difficulty breathing, especially during physical activity. Rapid heartbeat. Increased heart rate due to reduced oxygen supply. Cough. Dry, persistent cough as a result of lung irritation. Medical and surgical treatment. The treatment for pneumothorax depends on its severity and underlying cause. Two main approaches are: observation. For small, stable pneumothoraces, doctors might opt for watchful waiting while monitoring the condition's progress. Chest tube insertion. A larger pneumothorax might require a chest tube to drain the excess air, allowing the lung to re-expand. In severe cases or when other methods fail, surgical intervention, such as video-assisted thoracoscopic surgery, VATS, may be needed to repair the lung and prevent recurrence. Counseling and prevention of pneumothorax. Prevention plays a significant role, especially for individuals at higher risk. Here's some advice. Quit smoking. If you smoke, consider quitting to reduce the risk of lung damage. Stay safe. Avoid situations that could lead to chest trauma or injury. Manage lung conditions. If you have pre-existing lung conditions, work closely with your healthcare provider to manage them effectively. Conclusion. And there you have it, a comprehensive overview of pneumothorax. Remember, recognizing the signs and symptoms and seeking medical attention promptly are key to successful treatment. Stay informed, take care of your lungs, and don't forget to hit that like button if you found this video helpful.